first, we're going to speak about the situation that was reported last night with a person who tested positive for the coronavirus. That woman is a healthcare worker. She's 39 years old. She had been working in Iran and came back on Tuesday to New York. She did not take any public transportation. As she was a healthcare worker, she was very aware of this situation and the potential for this situation. We don't believe that she was contagious when she was on the plane or when she took a private car from the airport to her residence. But out of an abundance of caution, we will be contacting the people who were on the flight with her from Iran to New York and the driver of that car service. The healthcare worker also was with her spouse. He was also a healthcare worker, so they were both aware of the situation. Her husband is being tested also, but we are assuming that he would be positive given the circumstances, and he has been following the same protocols that she has been following. They are at home, at their home. The healthcare worker has manifested some respiratory illnesses, but her condition is mild, so she's at home, and she's not even hospitalized, even though she has tested positive for the virus. In this situation, the facts defeat fear because the reality is reassuring. It is deep breath time. First of all, this is not our first rodeo with this type of situation in New York. 1968, we had the Hong Kong flu. 2009, we had the swine flu, where we actually closed like 100 schools in New York State. Avian flu, Ebola, SARS, MERS, measles, right? So we have gone through this before. When you look at the reality here, about 80% of the people who are infected with the coronavirus self-resolve. They have symptoms. The symptoms are similar to what you would have with a normal flu. And for most people, they treat themselves, over 80%, and the virus resolves that way. About 20% get ill. The mortality rate is estimated to be about 1.4%. 1.4%. What does that mean? The normal flu mortality rate is about 0.6%. I get the emotion. I understand it. I understand the anxiety. I'm a native-born New Yorker. We live with anxiety. But the facts don't back it up here. Also, we're extrapolating from what happened in China, other countries. We have the best healthcare system in the world here. Excuse our arrogance as New Yorkers. I speak for the mayor also on this one. We think we have the best healthcare system on the planet right here in New York. Amen. So when you're saying what happened in other countries versus what happened here, we don't even think it's going to be as bad as it was in other countries.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.